What's going on, everyone? Happy Sunday to everyone. Hopefully everyone's staying safe. If you had to take a COVID test this weekend, hopefully you tested negative, and hopefully you're having a great Memorial Day weekend so far, and hopefully you're doing it safely and not doing any risky activities. As mentioned, I've been doing some changes to the website. Hasn't been going along as fast as I wanted it to, but I have been making some changes. The other virus section of the website finally is a little less cluttered. I added another section below that for celebrities and deaths, where we have now split up celebrity health news and celebrity deaths into their own section. There will be another section that you will see appearing at some point this weekend, and that is COVID studies and papers. It's going into its own section. So you have neurological issues, you have fatigue, you have heart issues that can cause diabetes, all these different things. There'll be a category for each one of them, and any study or paper I find with that will be just placed into that category, and it'll be so much easier to find rather than just clicking on this and you have all these different things just jumbled up. It's just a mess. It's too hard to find out. If someone wants to find out all the neurological studies that I've added so far, well, that will be all in one category. Also, here's something else that's changing. COVID positives. That's getting split up. There's going to be a section of its own with multiple different categories. You're going to have U.S. political figures. You're going to have international political figures. You'll have sports figures. I might even split that up to international sports figures. I don't know. Then you'll have celebrities and who knows, maybe something else. But something needs to be done with that. Even with less people getting tested, this number is still rising. We actually have a COVID positive to report on right now. U.S. Representative Becca Poland of Vermont has tested positive for COVID on Saturday, May 27th, 2023. That's this year. At least that's when she's reporting it. It could have been Friday night, but she's currently 55 years old, and guess what? She does have one prior infection. From what I saw, the date of that was, or at least the date that was reported, was June 20th of 2022. All right, let's move on to the news. Yes, it may be Sunday, but we have a ton of news to get to through today, and some things, like we do sometimes, are just going to be a headline because we cannot read all news stories. I'm looking up here. I think there's about a dozen of them total. Yeah, 403 COVID cases in India in the last 24 hours, and they did add some deaths as well. 5 new deaths were added there. All right, this is concerning. This is something we've been following on from time to time lately because remember, Australia, this is what we're referring to. Australia's coming out of summer, they're going into winter. They're in the reverse of what we do because remember, the sun shifts north at this time of year, so the northern hemisphere getting summer, they're going into winter. And what happens in the colder months? Well, that's when viruses tend to go up. And COVID numbers are increasing across Australia, but in alarming sign before winter. And if you look here, over the past 7 days, there have been 41,188 cases. Remember, I don't think they track at-home test. And is everyone even getting tested? That's a 7.7% increase. It's also increasing with flu numbers as well. So, yeah, things are really starting to get actively in the wrong direction down in Australia. And I should add one more thing. There is an increase in deaths. It says the state has an increase of 864 cases. This is just one state in Australia, and 69 deaths. So yes, the country as a whole has seen a death rise as well. Also, we're not done yet, and we're not going to try and pronounce this, but this is over in the Bangkok Post. It says their hospital is seeing a significant increase in the number of hospitalizations, and because of that, this hospital here, Sergei, we're not going to pronounce it, is currently full. They're running out of beds because of COVID infections. So yeah, they're definitely in an emergency state. Again, I'm not going to dispute it, but another reason why the emergency should still be continued, because if you're seeing stuff like this, that then clearly, yeah, that's an emergency. You're in a state of an emergency if the hospital's full. All right, how about this? COVID outbreak will shut down part of Vallejo City Hall next week, officials say. So this is exterior of Vallejo's City Hall. This is in California, I believe. And yes, they are going, yep, it's in California. And yes, they are having a COVID outbreak. And City Hall will be shut down. Not surprising because, as we know, and we'll get to the variants in a little bit, so we know the XBB.1.16 is highest. It's almost highest on parts of the West Coast. Moving on to our next story. And this is not a good one. It says here, drugs from cancer meds to children's Tylenol are in short supply in the U.S. So there's a whole bunch of drugs. 300 different medications are in short supply at this time in the United States. That, to me, classifies as an emergency. But, again, we're not going to dispute it. It is what it is. Nothing I can do to change it. And, yep, this is really bad. So if you have someone who's sick or something, even a child or anybody, and you desperately need a drug, chances are it could be one of these 300, which is, it's a problem. All right, this is a problem as well. This is really concerning. This is in England. Percentage of people over 60 who test positive for COVID who are dead within 28 days. And, yeah, that's just shy of 8%. It was up to 10%. It dropped a little bit, but doesn't matter that it dropped a little bit. Does not matter at all. Look at the trajectory here. Yeah, it does drop a little bit at times, but the baseline starting higher almost every time. Now, the last go-around, it finally bucked that trend, but as you know, they're about to enter a new wave in the UK as well, in England too, so yeah, we'll probably go back to this trajectory again, possibly, because last year, most countries around the world had a wave in spring, and that was, the trajectory was higher each time throughout the rest of the year. Is that about to happen again? If it is, this is not a good place to start off from. Moving on to our next story. Monkeypox now. Austin, Travis County records first new monkeypox case since February, and this is in Texas. So yes, cases of monkeypox. They're going around. We've reported several of them lately. All right. George Maharis, star of Route 66, has died at 94 years old. I don't believe I saw a cause for his death. All right, moving on to this. This is something that needs to be reported on. U.S.-Mexico fungal meningitis outbreak. U.S. and Mexico ask who to declare a public health emergency of international concern over fungal meningitis. I would agree with that. We've been seeing a lot of things about this lately. Some things we haven't reported on here, but yeah, this is fairly concerning. 2 dead and over 200 at risk of suspected meningitis after surgeries in Mexico. I think, was it last summer? We were hearing about this. So, yeah, this is relatively concerning. We haven't heard about this in a while, but I seem to recall hearing about it last summer. I'm probably going to have to add the word meningitis to my list of things here that I search every day. Yeah, not good that my list keeps getting longer of things to search. That means that we're entering more health problems, issues, and things to be worried about. All right, moving on to this from the Today Show. This will be our last news story of the day. The Papa Murphy's. It's a pizza company, I guess. Papa Murphy's chocolate chip cookie dough. Yeah, it's being recalled. You might not want to get Papa Murphy's pizza dough right now. The CDC is investigating a salmonella outbreak that may be linked to contaminated cookie dough after at least 18 infections were reported in 6 states. The CDC says some of those who became ill had eaten raw cookie dough. All right, that's not healthy to do. I mean, I get it. You get it in ice cream sometimes. Whatever, you shouldn't be eating raw cookie dough. It's not necessarily safe. Sold at Papa Murphy's pizza store. So, yeah, this is concerning. That's something to be concerned about. Walgreens. Note about Walgreens. We will not have a Walgreens update video tomorrow. So if you were looking for that tomorrow, it will not be tomorrow. Because of the holiday weekend, it's supposed to fall on Tuesday. We'll see if it actually does. It would be sometime in the afternoon, between like 1 and 4 o'clock, that they update. We'll see. That's the way the rules are supposed to be. Actually says it on their page here. I can go to it on, I think it's page 5. And it says here, it would be on, if a Monday is a holiday, then it will be moved to the following Tuesday. So, we'll see if that actually happens. Alright, moving on here to, let's take a look at this day in pandemic history. We've got a couple things today. May 28th of 2020. The recorded death toll from COVID-19 in the U.S. surpasses 100,000. And as you know now, we're over 1.1 million Heck, we're probably well over 1.2 million now because we're missing so many deaths right now. We're not people not getting tested, people being misdiagnosed. It's a whole fiasco within itself. And there was one other thing on this day in pandemic history, May 28th of 2022. The weekly average of new COVID-19 infections in the U.S. is now 6 times higher than it was in 2021. Currently, there are 119,725 new cases reported each week, a number that is grossly underreported according to experts compared to May 28th, 2021, when there were 17,887. Yeah, at the start of the pandemic, it was hard to get a test, and at this day and age, it's hard to get a test, and actually this was 2022. In some cases, it's been hard to get a test throughout the entire pandemic. All right, moving on. We did have our wastewater update this morning, so we don't really need to go through this. It's the video just before this one, if you did not see it. Latest COVID variants, XBB.1.5, 53.8%, XBB.1.16, 15.1%, and that is highest on the West Coast. XBB.1.91, 11.8%, XBB.1.92, 6.1%, XBB.2.3, 4.8%, XBB.1.16.1, 3.9%, XBB.1.5, 2.2%, FD.2 is 1.5%. Yes, variant stew, variant soup. It continues. New Jersey hospitalizations, they were 192 yesterday. They are down to 180 for today. So you can see there was a drop today. I'm sorry. Now it says it was 195 yesterday. I thought it was 192 yesterday. 6 people on a ventilator, and ICUs are at 18 at this time. Let's see if they dropped. Nope. They actually rose over yesterday by 4. All right, moving on to my state of Pennsylvania. It was a very busy day in Philadelphia yesterday, not just for EMS incidents, and I know we're talking about health topics here, but fires were bad as well. There were actually 9 active working fires, some that were really bad yesterday in Philadelphia. 766 EMS incidents, so that was a busy day yesterday. Let's take a look at the burbs, and right now Montgomery County is not doing too bad. Earlier, when I looked at this about an hour ago, there were a whole slew of respiratory calls, and that's concerning. Oftentimes, respiratory calls can be linked to the coronavirus. Taking a look at Chester County, Pennsylvania, not too bad here. There were a couple sick person calls, and sometimes that is the miscellaneous category. That could be COVID, it could be cancer, it could be anything, flu, cold, whatever the case may be. New York State, we probably won't get an update out of New York State again until Tuesday. We may not get hospitalizations again until Wednesday. I don't know. We'll see. We may at least get Saturday's hospitalizations. I don't think we'll get the first day of the new week. 535 cases were reported on Friday. As you know, the positivity is 4.4%. That is up from 3.4%. And we can actually change regions as well. Let's go down to New York City. I think we can go to New York City, can't we? I think we can see New York City's positivity here somewhere. Yes, New York City itself, some of these boroughs. Here's one right down here in Richmond, which I believe is Staten Island. 5.6% positivity there. So that is relatively concerning. And that's the 7-day average. Okay, here we go. The actual positivity, the one day on Friday, was 7.1%. Yeah, that's not good. When you start getting closer to 10%, that's not good at all. Latest hospitalizations were at 581 in New York State, 55 people in the ICU. Let's briefly take a look at some international data, shall we? As you can see here, the world cases are down 25%, deaths are down 18%. Unusual to see this number shrink a little bit, but there's a reason for it. France cases are up 83%. Deaths are up 157%. Russia's up 218%. Cases are up 259%. Or excuse me, their deaths are up 259%. So because of those big increases, this number is actually not increasing, which is a relatively concerning sign. Alrighty, folks, that does it for today's pandemic update. We'll have another one again tomorrow. Keep an eye on my website, datareport.info. You're going to continue to see some changes coming. I am way behind on updating all this celebrity information, COVID study. There's a lot of stuff that I'm working to add on because, as you know, it's been a busy news period. If you like this video, give it a thumbs up. If you want to see more content, hit the subscribe button down below. Thanks for watching, everyone. Stay safe.